Good morning, everybody. My name is NIKK and I am a research consultant at Nordic. And today it is my honor to moderate this webinar, Who Cares About Men in Care? I assume that all of you today online do care, and this webinar won't be complete without your participation here. Therefore, I invite you to share in the chat greetings, where are you from, what are you working on with regards to this topic, and also share interesting information that you think for this community would be interesting to see. Also, it's important to note that this webinar is recorded. And with that, we are moving forward to the first part of the webinar, and my colleague, Deborah Birger, Senior Researcher at the Nordregio, will guide you through the visual representation of the various research publications that are a result of this whole project, Share the Care. It is said that one picture tells more than 1,000 words. Therefore, Deborah will guide you through the research publications visually. So, Deborah, the floor is yours.
Thank you very much. I am very glad to be here. I will present a bit of the publication, but I will just start with saying a few words about this project. Very glad to be here. The project was running for 4 years, in which partners from 3 countries, Norway, Finland, and Iceland, were trying to implement measurements related to increasing the share of men in nursing education. And nursing, together with other care occupation, is a very segregated occupation and field of study. Less than 25% of graduates now are men. In the Nordics, although there is some variation across countries, but less than 25%. And what we tried to do in this project is to implement specific measurement, targeted implementation of a measurement that can help increase the share of men in nursing education and help them complete. These measurements were related to implementation of follow-up system to see how many men are registered in this educational program, and then to see by gender, raising awareness both in terms of the teacher and other groups of the study material and environment that is related to the situation of men in care. Improving the communication and recruitment, because what is happening is that many, and you will hear about it soon in a second, that many of the recruitment strategies are very gendered in the way that they portray the occupation. So there is also emphasis on that. In addition, there were contacts with a study counselor and other aspects. So we have 6 specific target implementation of target strategies to increase the share of men in nursing education. And what we have done is that we follow this implementation, and the report itself is already available online. I will share it in the chat in a few minutes. But what we have on the report is these 2 reports. The first one is Share the Care Strategies to Increase the Share of Men in Nursing Education, which is the report itself, a full report covering what we have done, together with a literature review on the situation of men in nursing in general and in nursing education specifically. Together with that, we have what we call a first aid kit, which is a policy brief that aims to have the main recommendation and conclusion from this research, specifically for people working in the field and in different level, in terms of the national level, the regional level, but also specifically to the educational system and the teachers in teaching these fields. And together with the main report, we also have an annex that covers all the report measure that we have implemented in the project. So I will share the link, and please share it, read it. I think there are many interesting recommendations, and what we will do in this webinar, we will present the main finding and discuss these findings.
Thank you, Deborah, so much for excellent presentation. And we were very lucky to have great partners in this project. And now let's move to the presentations of them and the main points that they would like to share with us. So there were 3 countries involved. It was Iceland, Norway, and Finland. And let's start now with Iceland. We have two professors joining in today in the studio. It's Eidis Kristín Sveinbjarnardóttir and Gisli Kort Kristoffersson from Universities of Iceland and University of Akureyri. And the floor is yours, and please welcome.
Thank you. It's nice to be with you today. For the 14th year running, Iceland has taken the top position in the global gender gap index, which benchmarks national gender gaps on economic, political, education and health-based criteria for women. The gap measuring any area between women and men in terms of their levels of participation, access, rights and benefits. This success story might give you the idea that Iceland has equality and diversity issues solved. We are so sorry to have to tell you that we are far from it. Unfortunately, the issues of men in women-dominated work has not been prioritized in Iceland. This is called the Nordic gender equality paradox. In Iceland, we are having difficulties with recruiting men into nursing education, and therefore our nursing workforce represent mostly women. In most healthcare professions, the gender enrollment in undergraduate education is more balanced, close to 50-50 or 40-60. The exception is nursing education. For the last 3 years in Iceland, from 21 to 23, men make up 5.4% of the enrollment, and they make 4.4% of the number that graduate. These are our numbers despite participation and efforts in numerous projects to change the situation and enroll more men into nursing education. So are we in Iceland making any progress? Yes, but we are slowly and gradually moving from a little more than 0% enrollment into nursing education towards 5% enrollment. Since 2016, few of us with encouragement from the Icelandic Nursing Association have been very resilient in keeping up the conversation on men in nursing, using all kinds of events, social media and educational courses to talk about men in nursing. So at least we have succeeded in distributing gender classes to teachers and health workers in nursing. That is a succeed that we've made. Gisli, please.
Yes, well, thank you for this, and welcome everybody. Hope everybody's doing well at home. When we think about what we can do, what the problem is, and how we can solve this, it's good to just have a clinical example. Both Eidis and I are clinicians in psychiatric nursing, so we like clinical cases. So let's talk about Peter. And Peter wants to become a nurse, and he wants to start in the first year nursing program, and we can name Iceland as an example, but this will apply to many other countries, although not specific. The specific examples will not always be accurate. It's a good example, we think. Now, when Peter starts looking at the program, he starts looking at the university webpage, and he notices the recruitment material for nursing is about 90% female. Other faculties have more around 50-50 ratio. So that's one of the areas we can focus on, and we have been focusing on in this project. In the hall in the front office, where Peter starts in September, he's very happy to start his nursing program. He notices right away that there are tiny messages that maybe he shouldn't be there, maybe he doesn't belong. And one of that is a big glass cupboard that has dolls dressed in female nursing dresses and statues with female nurses holding candles and lamps, like Florence Nightingale. The teachers in Peter's classroom in the beginning of the semester, they always address the class with "Hi girls." Now, there is Icelandic is a very gendered language, so this can be especially problematic in Icelandic, where there's a consistent message that you're not there, you're not included in the group, and thus you shouldn't really be there. Peter's classmates mostly talk about cosmetics, knitting, motherhood, and make little effort to be inclusive in the conversation topics or outside of work school activities, which are all fairly gender specific up to a certain extent. And of course this opens up a Pandora's box of what that is, but I think people know what we mean when we talk about this from Peter's perspective. When Peter opens his medical surgical textbook on nursing, most of the photos or pictures in the textbook are of women, nurses in dresses, and there's not a lot of male role models to be shown there. Now, when Peter goes to his first clinical program, he's very, he's kind of survived this first semester and he's starting his clinicals. And he shows up very excited to a first day of clinicals. They do not have scrubs, nursing uniforms in his size. So that's a big to-do kind of to figure out how to find something that fits him. And this is another small indication, what we sometimes call a microaggression, telling Peter he shouldn't be there, he does not belong there. He has to use the bathroom, when they finally find scrubs that fit, he has to use the bathroom to change his clothes, because there's no male dressing room there, it's just for females. So he goes to the basement and that's where he changes his clothes. Now, Peter, on an effort of the university, he was invited to join a minority group for males for support during his study. He has a hard time rejecting it, but also he does not want to be a special case or be drawn out too much. So he just, and this research shows this repeatedly in our interviews, that these students, they do not want to be made of special cases, they don't want to get special treatment. They just want to be treated like everyone else. And so Peter also must convince his family he wants to become a nurse. His family thinks he should go into medicine because he has a record of being a good student with ambition. So of course he should not go into nursing, he should go into another field, like medicine or physical therapy, things like this. This shows up in interviews again and again. And it was the same message the study counselor told him when he talked. And during family parties, Christmas gatherings, things like this, he gets little messages like this all the time, that he should do something else. Now, so Peter, although none of these things are horrifically big, they do combine and make it more difficult for Peter to both to become a nurse or start nursing program, and also be a continuing part of it. Now, Peter is not feeling his best because of these microaggressions that we've been talking about here. And so it's important for us to understand that these are the things we need to change. Not necessarily one big thing, we also have to change 1,000 little things. So it is death by 1,000 cuts, really, when it comes to males in nursing. And we are all convinced that these microaggressions can be changed, like we said. And we have learned in this project that we need to map this out, and we need to react, and we need to be kind of humble towards this, because it's so easy to say, oh, it doesn't matter, it's a small thing, but combined every day, it becomes very burdensome. And these things are all easy to change. We can't change them. So that's what this project has really been about. It's been about Peter. Yes. Thank you.
Thank you.
Excellent. Thank you, Eidis and Gisli, so much for this very poetic and metaphorical introduction. And now we all kind of can see this situation much more vividly, I guess. And as I'm inviting the next speakers from Norway, Mali Storbakken and Ole Nordfjell, to share the insights of their learnings throughout the project, I also remind you, the participants, ask questions, write comments, because we will base further discussion on what you have to say. So, Mali and Ole, the floor is yours.
Thank you, Maja. Well, to pick up where Gisli and Idis left, the big question is how can we attract more men to nursing and support them to finish their education. We are from Reform, an organization in Norway who's dedicated to promoting gender equality and diversity with a focus on men and masculinities. Our points today will be based on our experience with men in health and care professions and also experiences from this project. And from our experience, we think it's essential for staff and teachers to understand the unique experiences that men face when entering nursing as a profession. And just as you would if you wanted to support people from other minority groups in nursing, you need a basic understanding of the specific experiences and needs of male students. At the same time, it's important to remember that men in general are not an underprivileged group. Men, in fact, especially when men in nursing, sometimes find themselves receiving a lot of positive attention and being put on some sort of pedestal. And this is often against their will. And from our knowledge and experience, male students in nursing generally don't want to stand out and being singled out and being the man in nursing. They want to blend in and be a part of the nursing community. And they chose nursing because the values and skills involved are meaningful to them, and just like any other nursing student. However, many male students in nursing find themselves feeling isolated. And this is especially the case during practical placements. And as educators, it's important to understand these dynamics and to stay curious about the experience of male students. And this curiosity and understanding can be the foundation for meaningful actions that support more men in nursing.
And one of the measures, picking up where Molly left, and having this understanding of the situation of men in nursing education, one of the measures that we tried out in this project was grouping men together. Because while some might think that men in nursing education is a scarce commodity and therefore need to be spread out across the classes and groups within the nursing education, that is not the way to go forward. So men in faculty nursing are gender blind and not see the situation that Gisli talked about earlier, and think that therefore there is no gender going on here and therefore no measure is needing. And also at the start of the project at the university that we collaborated with, Østfold University College, the practice there was also to spread the male students evenly in the groups. So that meant that in the first term there are student groups of 8, and most often there was just one male student in these groups. But based on our suggestion and knowledge, we changed this so that in the groups there were at least 3 students in the groups of 8. And the feedback on this intervention was very positive, that it reduced feeling of isolation, that the male students got in contact with other male students and got to know their peers and not to be put on the spot as the male students in the nursing education. So I want to say that this measure has also been a success in other fields, like men in kindergarten, and I want to encourage faculty and universities to start working on gender balance, and it seems maybe like a question that is very difficult to do something about, but you can do something small like grouping men together that can have a significant and big impact for the male students and for being a start. So thank you, and give the word back to you, Maja.
Thank you, Mali and Ole, and also thanks to Mr. for asking questions. We will address this question as we go at the later stage. But now I would like to invite Irina Tiainen, Senior Lecturer at Lab University of Applied Sciences in Finland, to share their Finnish experiences in this Share the Care project. Irina, the floor is yours.
Thank you, Maja. I will continue with the question, why male students drop out of their studies, and what are the actions that can support them in completing their program. As a result, I can mention that progress in studies is influenced by individual characteristics, include personal life events and factors related to the organization studies. Individual characteristics include learning abilities such as time management, self-direction, academic writing, and motivation. Personal life events of students such as financial and life management difficulties strongly impact on the progression of studies. Combining work and study may lead to extended study periods of taking breaks, but on the other hand, it can provide flexible transition between work and study. At Lab University of Applied Sciences, students have an opportunity to integrate their studies with employment and receive a salary. So when students integrate their studies by studification process, they work, for example, as practical nurses and simultaneously learn clinical skills based on the curriculum. As a result, I bring some specific actors that students mention to cause challenges in their studies. Because there are many career changes in studying programs, because since previous studies there might be huge time elapse, and it can cause a confusion about the study techniques and one's own learning styles. And many of students don't know even what is their study technique and best way of learning. Also, uncertainty about the skills that are required in studies in universities may cause concern. Students' question is in that case, how to study and what are the key aspects. Many students have lack of digital skills, and it's also often experienced as a challenge. Thesis process is difficult based on the lack of academic writing skills, and that is one we need to make effort to improve the process and increase the skills that students are able to combine with the challenges. The situation, if one doesn't manage to get internships, causes a lot of challenges, because of course if one needs to travel away from hometown, it causes additional expenses. What we can do by tutoring. Prior learning accrediting and recognizing plays an important role. Clear guidelines and instructions makes process smooth and helps students to progress in studies. It also increases the motivation when students can focus on the learning on one specific level. I would emphasize the collaboration and communication between teachers and teachers specializing in nursing as seen as important for students who have faced clear difficulties in completing individual studies. Also, in individual study plans are really important when we want to help male students to cope with their struggles to ahead to graduation. Thanks.
Thank you, Irina. And now when we have kind of better overview of the Share the Care project, and before we dive into the next panel discussion, we have a question from Mista. What are the main drivers of men to go into nursing? And how about different cultures? And also how about different communities like LGBTIQ plus community? So if anyone of you panelists feel free to answer this question, but I think that also in the next panel where we will have practicing nurses, maybe we can at least answer the question of the drivers, but Ole will respond to the question as it is right now.
I guess as nursing is a broad field, so you can do almost anything as an educated nurse and a practice nurse. And of course, you have specialization in different areas of nursing. But the core, I guess, is knowledge of people and competence about caring and health. That is kind of the core of the subject. And of course, this knowledge and people skills is a great motivator to go into the field like nursing, and this competence is not like just women have these competences and see the meaningful of working with other people. So that is my kind of initial response to this question.
Thank you all so much. So this is meaningfulness. And Gisli also would like to comment. Welcome.
Oh, thank you. These are very good questions. We've, of course, thought about them too. And so for other groups, we're just really in this project starting with the biggest group that's underrepresented within nursing. But of course, we want nurses to represent the users they serve, and it's true for this areas as other areas. This one happens just to be the biggest one. If you can find a bigger one, please let us know, and we can start with this one. But until then, we'll focus on this. But of course, the other ones are important too, and that's what we're thinking about in this project. So very good points. Thank
Absolutely. You. Great question. Thank you, Mr. for that. And we will definitely come back to some kind of reasoning on that as well further in our webinar. But now we have moved to the second part, which is the panel discussion on gender equality in care and what could be done to change the current situation. And we start with practitioners joining us remotely. And the first speaker is Christopher Christopherson. And as before you dive into the question itself, could you tell your story? Why did you decide to become a nurse?
Yeah, hi everybody. My name is Christopher, and I currently work in a psychiatric intensive care unit at the University Hospital of Iceland. And I previously worked in the business sector, mainly in marketing, and I didn't really get any fulfillment out of that, so I decided to change careers in my late 20s. I wondered for a while about what I wanted to do and how I saw my own future. And I always had an interest in healthcare, and I actually worked in a nursing home when I was younger, but becoming a nurse still didn't really occur to me at this time when I was in my early 20s or after high school, even though I didn't have to look far and beyond for inspiration, since my own mother is actually a nurse and a midwife. So, and when I started nursing school, I was really worried actually about what people would think. Like Gisli mentioned in his story about Peter, going from a career in business into nursing. Is that guy crazy? Was maybe some of the perspectives I thought people had. And I think maybe this thinking reflected my own prejudice, but some part of me believed and still believe that other people would see me as a bit foolish for going into nursing. But I have no idea who these people are, since they don't really walk up to me and tell it to my face, most of the time at least, but it has happened. Now I'm a lot more comfortable in my own skin, and I believe that this type of thinking reflects other people's own insecurities, and some people I think are more open minded have walked up to me and confessed that they themselves thought about changing careers, maybe into nursing actually, and that they were feeling like they were stuck in a rut, and have asked me, a lot about it. When I started, I didn't really expect a lot of men to be there, and this expectation was confirmed when I saw that maybe just one or two other males in the class. The current situation here in Iceland, like Eidís and Gisli mentioned, is the whole nursing profession, only 4% are men, and only half of those have graduated from universities in Iceland. Others are foreigners or people that have moved to Iceland. And 4% is already one of the lowest numbers worldwide. And if it weren't for the large portion of the workforce made up of people of foreign origin, there would be only half as many nurses in Iceland.
I see.
And
Yeah, and then,
sorry.
yeah, and then just keep sharing the main points that you think we should pay attention to.
Yeah. When I graduated, I was recognized for having achieved the highest bachelor degree grade given in Iceland, and this was a great honor, and I received some media attention. Most of this attention was positive, but I must admit that I was certainly let known or told by some people that my gender had maybe something to do with this recognition. And some of the things that I noticed that I want to tell you about is that a famous TV personality asked the dean of the faculty in a radio interview if the faculty had required a man to get such a good grade. And several times I've been asked by fellow female nurses if this would have gotten the same media attention if I were female. And the last one that maybe hurt the most was that I was made aware, maybe a year after graduating, that some of my classmates thought it wasn't possible to achieve this, and that I was favored by the teachers, or was a teacher's pet, or I was cheating, which is something that also made me laugh. But since I graduated, being a male in this profession hasn't really been something I often think about. I just feel like most of the time I belong in the profession. Maybe it's because I work in psychiatry, where there are proportionately more male nurses than in other sectors in the hospital services, especially on my unit, where there are about 1/3 of the nurses are male. But I still sometimes notice stigma and prejudice, especially in the community. And I think that perception still exists that nursing is thought of a job not suitable for men. I think that still exists here in Iceland, and men get questioned a lot more why they go into nursing. The females don't get asked all the time why they decided to go into nursing, so there's always the need for people to ask the men, why did you go into nursing? I think other female nurses sometimes think that men only go into nursing to have a good chance of managerial positions, and they are going to go into nursing to take them away from them. And I think also some perspectives exist that either men are too tough or too masculine to be nurses, or they are too soft and too feminine to be men.
Amazing insights, Christopher. And the questions are already coming in, but we will take them after everybody has spoken in this panel discussion. So let's move to other nurses we have today here at this panel discussion. And Alva Johnny Sorensen, could you share your experience? How did you become a nurse?
Hello, Stockholm, and thank you for inviting me. For 30 years, I was working in the entertainment industry until the pandemic abruptly put my career at a halt. But fortunately, I had a very good colleague and friend of mine who is also a pediatric nurse, and she could offer me a position at the local hospital here, where I, as a non-health personnel, started as a COVID host. So I was sitting in outside the hospital asking the questions, have you been abroad? Have you been feeling sick with the flu or things like that recently, to all the patients going in. But after a while, I was given the opportunity to perform the same role in the emergency room, where I worked closely together with a nurse and a medical secretary, since we were the first line and non-health personnel. And this experience sparked my curiosity about the various diagnoses that I encountered when all the patients came with their medical referrals. So I frequently asked the nurses and the secretaries about these conditions, and they encouraged me to pursue a nursing education due to my keen interest, basically. And then, long story short, inspired by their advice, I decided to enroll in the nursing program here in Norway.
That's a great story. And so now when you are enrolled and you experience this, what do you think are the main points we should pay attention to?
Well, there are several points, but from my point of view, one of the most important things is how females see us male nurses. And I work as a nursing assistant at the moment, since I'm not finished studying. And I also experienced in my clinical placements that there are a lot of female nurses who still struggle to accept men in the nursing profession and viewing it as a female dominated field. I also observe every time, or most of the time, when I enter the staff room, there is kind of a shift in the conversation dynamics. And I don't think that has specifically to do with the nursing part, but actually from a professional point of view, I think the conversation turns more to the field of work. Like we are suddenly discussing more health-related things when the men come into the room than when only the females are sitting there. That's one point. And I also think, I still get comments like, do you think you deserve better treatment because you're a man? Or I also get asked if we really need more men in nursing from the females. So there is a way to go there. And the second point I think is one of the most important is that while the female nurses are fully capable of providing excellent care to male patients, we see that many adult female patients prefer having a female nurse for intimate tasks like washing and grooming and that kind of things. And I also think that similarly, the male patients will feel more comfortable and at ease if they have the same option to receive intimate care from a male nurse. And we all know that that will not be possible to do 100%. But I think with a bigger share of male nurses, it can at least be easier to give the patient that opportunity.
Thank you so much for these insights, and as we will also discuss more in the panel discussion, but now I would like to invite another nurse in today's webinar, Alexander Manfred Siversen, to share your story. How did you become a nurse? And then what do you think are the major points we should look into on the more balanced care sector?
Yeah, thank you for having me. I began my nursing education after several years in the construction industry. My experience in the construction industry revealed how men often struggle to communicate with female nurses about their medical issues and other personal stuff. Many of them avoided seeking necessary healthcare because of the communication with the female nurses. So that made me to choose to change this because of the communication, because I wanted to be a manly nurse that could communicate with everyone. But another point that chose to make me to be a nurse was I have a long family history of being a nurse. I'm a sixth generation of a nurse, dating back to the 1800s. And both of my parents are actually nurses, both my mother and father. So it has been very much discussion around the dinner table about what it will be to be a nurse and how it will be to help other people. And that made me paint a good picture of what it was I was supposed to be. So yeah, that's the history of why I wanted to be it. But I think the main goal that need to be changed is I have experienced it myself, that much female nurses just use me as strengths to lift patients and to do the masculine and manly work at the hospital. So I don't think they can see me as a nurse as themselves, just like muscles. So yeah.
Thank you for this experience sharing, and this is of course extremely valuable and gives this more kind of understanding of how the situation is evolving once you are in this profession. As a last panelist to this session, I would like to invite Janette Närinen, manager of the operations unit at South Karelia Central Hospital in Finland, to share the insights. What do you think are the most important things we should think of if we want to make a change? Janette, the floor is yours.
Thank you. First of all, I need to say that it has been a change over the years in Finland regarding men in nursing profession. I graduated as a nurse in 1997, and by that time there were only one male nurse student in our class. Unfortunately, he dropped out of school before graduation. I'm working as a ward manager nowadays, and the ward I used to work 5 years previously is on acute ward for about 40 nursing vacancies. And as I regard, I was counting, there were 9 vacancies for male nurses, or there were male nurses working on a ward by that time. So there has been a change, but I think that the more is needed. The most likely one thing of nursing profession is that one sees the nursing as a female as an image of a nurse. Even though the nature of the nursing has changed and the nursing can be very much dealing with techniques, understanding and equipments, unfortunately, general idea is that nursing belongs to a woman. Changing that general idea has not happened completely, even though men are applying nursing schools more than earlier. At least I have seen it here, working as a ward manager and seeing the nursing students, and sometimes also when we recruit nurses. But I was thinking about could that be also family-wise? We had heard the story earlier on that there were a family which has both parents were nurses. But could it be also the otherwise? And we are still raised up to think that the nursing is for women. And I also think that the salary is one topic while talking about the nursing, even though it's also for women, but it influences men also. And to become a nurse, it demands a lot, and still you don't see it in a paycheck. At least that's the conversation we have in Finland. And the area of nursing is so wide. There are areas that seems to be interest more male nurses. We can see that in Finland, in paramedics, acute care, like emergency units, perhaps a little bit in psychiatry also. We have male nurses on those areas, and most likely male nurses and the students want to apply those areas for the placements, which is good. but we still need more male nursing students in general. It should not be a gender issue. And also what I've seen here in our hospital, there are not many men nurses in manager positions either. And is there something that we could do more to get the more male nurses? Is there places we could advertise? Normally there are specific days at school, like open days, to come and to get the information about different career paths. Those days can go and one can see the variety of different career positions. And it might be that one sees nothing about nursing if chooses so. So how can we decide? How can decision be made without any information? And I'm just wondering other areas. Should we think places where we could definitely meet men, like in the army, at least in Finland, the organize information day about nursing for men in the army? Would that be possible? The other idea I was thinking about is to raise social media action regarding male nursing. There are many Instagram channels, like in our hospital also, and those always basically follow people to see our work on the ward, and that would be get the idea of nursing in real life. So the way people would see also men working in a hospital or the other areas in healthcare. And the most important is to change the mind of the set of nursing. Young people should see nursing as an option with the other career options, and not like those occupations that this is only for women. And by seeing male nurses around the whole healthcare area as role models would definitely help. And we also need to remember that nursing is highly respected occupation among other citizens. And I think that unfortunately, you just listen to people to hear Fermi idea, and the nursing is a patient's mind. Talking with the patient, and she or he might say the nurse says that or this. And the other way they might say that the male nurse said that or this. And that's the difference that I feel, that there shouldn't be that male. It's always a nurse. So I think that the changing that difference, it's very much needed. Thank you.
Thank you, Janette, for these very valuable insights. And now I would like to invite my colleague Deborah to help to moderate the question session, as we have some incoming questions to the panelists.
So, as you can see, Christopher, Christopher, there is a question for you. If you felt the same feeling also in other setting of work, or it's something specific to the where you are working now. And there is also a question related to the issue of salaries, and if you can, any of you address them if you wish. So Andrea is asking, Christopher, have you experienced different work places where the experience of being a male nurse was different?
Yeah, I have the most experience of working in psychiatry, and I think the psychiatry field is more maybe open to male nurses than other fields of nursing. And when I was rotating through the wards, different wards in my education or in my studies, I felt more at some wards the culture was a lot more feminine, and they were even more closed off to the male nurses, or they weren't as open to having maybe a male nurse, and they had the perspectives, that stereotypical perspectives were maybe 20 years behind something I noticed where I work now, where the gender split is more closer to 50-50 or maybe 30-70 than anywhere else, I think.
Just reflecting about what all of you said, that it's interesting that what we also present in the report is that there is this effect of role model, that there are chances of men registering to start nursing if they have someone in the family or some event that brought them into this, meeting a nurse that had influence on their decision, or having someone in the family. It's specifically what it's also brought. So that's the importance of having more role models. So this critical mass of number of men registering and men working as nurses is very significant. And it's to some extent what you are saying now, Christopher, in the sense that once you move to a place that there are enough men, there is more a balance and easy way to walk in these places for men. I'm going to look for more question here, and there is this question. I'm not sure that we can that is relevant to you, but it was argued that in the Baltic there are less men registering to nurse because of low paid job, and we might refer to it later. I don't know if you have any thoughts about it now, any of you.
Yeah, maybe Alf, Johnny, or Alexander, or Christopher, and also Janette mentioned this elephant in the room as it was formulated, this low pay. So how would you comment on that?
Well, I can say, yeah, it's low pay compared to other branches, but all in all, I think at least I can answer for Norway. I don't know about Sweden, Denmark, Iceland, or the Baltics, but in Norway, I think that the salary is basically kind of okay. But when you take into consideration all that's demanded of you, like we have the 3 shifts, we work day, evening, night, and the responsibilities we have for basically life and death in some incidents, I think the salary is low. That said, you see in Norway, most nurses work overtime every day, many of them, because, again, we are back to this, not enough personnel. And that is also depending on the salary then. I mean, if we could work a regular time, have a normal amount of hours in a week, then I think it would also be easier to accept the kind of salary that we do have. But when we are being worn out because we do not have enough hours, we do not have enough personnel, then the salary is way too low. And that is not being discussed in other from other fields of work. They don't see that we do not work 7 hours a day, and we do not work from 8 to 4 every day, and we do not work. I'm not blaming, or I'm not pointing at anyone, but we do not work in a store where we can go home after the day's job has been done, not thinking about it until tomorrow. I mean, we work with people who are dying, we work with people who is really sick, we work with relatives who need someone to talk to. There are so many aspects that go straight to our own psyche. And that is also something that should be taken into consideration when you look at the salaries.
Thank you, Alf, Johnny, and then maybe Alexander, Manfred, you can comment as a nurse in the 6th generation on this, right?
Yeah, I can comment. When I see on the problem from the both sides, both from the nursing side to what I'm supposed to be, and from the work I have done. Because when I was a construction worker, I had 900,000, and when I am a nurse, I got 500,000. So I go down 400,000 for much more work, and I have a life in my hands. So I don't see why should I got so much salary for less work than with a life in my hands. But I think the problem is more complex because a man has an important wish to get a family, and then we need to have a good salary and everything around it, house, and yeah. And then I think much men choose to don't do nursing because of the salary. We want a good salary because we want to support our family. So I think much men don't want to do it because of it. I think they push their wishes with helping people away because of the salaries.
I see. Thank you so much.
Yes,
But you know what? We have to move on because to the next panel discussion. And I think one thing is that the keynote speakers, you, the panelists, you can also type in the chat some of more answers if you have, or move on with the discussion.
But maybe we give the floor for
Yes,
a few minutes.
absolutely. And now the next question we would like to address is, but why do we need more men in nursing? Let's move on, and the floor is to Gisli.
You can also address the last question.
Yeah. Sorry, I thank you for this. It's been very interesting. I just want to talk about the salary situation. We did a big survey in Iceland about male nurses, both with the public and with nurses themselves. And the depressing thing that came out of that is that one of the reasons nurses wanted males into nursing was to make the salaries higher. And of course, this is a very kind of like almost like a defeatist attitude. And I understand that it's sometimes the reality. But of course, we want to raise the salaries of nurses because, like it's been said, it's important. It's important work with a lot of responsibility, and it's underpaid, a lot of stress, things like that. It has nothing to do with what gender works in the field. I mean, it's ridiculous that we even have to go there, but it's one of these very sad things that come off this Nordic gender equality paradox, that we're still there, that we feel we need to increase males in a profession to increase the salaries, right? Oh, it's very sad. So anyway, so do you want me to talk briefly about the reasons?
Right.
Yeah, it's one of these It's one of these things that have already come up a little bit, and this might be a good time to address it. And there are many reasons why we should increase male enrollment into nursing, and you can all name a few. For us, it's really been 4 big ones, and then we can elaborate on those. And I just want to review them very quickly. First of all, it's the kind of the human right argument, where we just males should be able to go into nursing without having microaggression, without having pushback. It has to do with choice. It has to do with becoming the person you want to be, whether that includes how you want to express yourself or what you want to do. 2, workforce reasons. That's just the size of the recruitment pool, and we've already mentioned this a little bit too. So if we're only recruiting from half of the population, of 1/3 of the population, or whatever it is, if we would only recruit into nursing people with red hair, we would have less nurses. And it's the same with gender. So we're facing a shortage in Norway already. We're starting to see this in other countries. So that's the recruitment pool argument, really. Then there's a quality reason, and we've already mentioned this. There's some questions out there that have really alluded to this point, where nurses should represent the users they serve. This goes for race, ethnicity, culture, all of these different things, and gender is certainly one part of that, and people have been talking about this. And then there's also some evidence to suggest that a more kind of gender balanced workforce or workplaces are a little bit happier, that there's more balance, there's more different viewpoints. Of course, this has to do with diversity in general, and gender is one of those points. So those are the big 4. I did them in 3 minutes.
Excellent.
Is it okay?
It's perfect.
Yeah.
Thank you so much, Gisli. And now, after these first 2 sessions, we have spoken quite a lot about where we are, what are the challenges, and also maybe our brainstorming, how can we solve them. But how does this all look into the context of the future? And I would like to invite Bogi Eliassen, Director of Health at the Copenhagen Institute for Future Studies, to comment. How does all the discussion look like from your perspective?
Thank you so much. And first, thank you for taking on this topic, which you don't see often. So we see nurses coming, the role of nurses coming in quite often, but not the gender balance, more the imbalance on the payment, which is very often in different kinds of discussions. So, and I think this has been a very rich start, or a very rich discussion, and also based on good work with the report. So I will take this from a different angle. So what is the general role of nursing and health going forward? So this is a picture that will change dramatically over the coming years. So when we built our health systems, it was focused on acute. So this was accidents and communicable diseases. Today in the Nordics, 87.5% of the disease burden is based on slow chronic disease. So it's not just about what the gender in this is, also what do you recruit for? And a part of the imbalance, in my view, and a part of the burnout that we're seeing in general, both in male and females, in healthcare professionals and also in nurses, is that we are not educating and recruiting for what the work actually is. So that is one thing. The other thing is then what we also heard from the last speaker on the diversity. Yes, of course, diversity is very interesting. But then there are different ways of looking at this. So do we believe that there actually is a difference between male and females or groups? I'm fully in on the approach, and this is what we also see, that diversity needs to be there. But there is the nurse will have a cold and a warm hand in the future. It will become more technical, right? So the empathy is needed, but there is also other skills that will be needed more than you have in general nursing education today. A lot of the care will move outside of the hospital. What does that do? Do we need different ways in this? I also think that we will see a different view with the coming generations on gender. So it's not just a female male anymore, but it's also more fluid if we see difference in the coming generations. So there are a lot of discussions to take in that one. But the bigger picture here is, what is it actually we want nursing to do in the health system? And what is the focus of the health system going forward? Our approach is really to say, how do we build the healthiest population? So a huge role that I see for nurses more than anybody else in the society is, how do you nurture health, not just how do you provide care? And then you can begin to think about, is there a gender balance, imbalance, or do you divide in these parts? And that has very much to do with leadership, inclusive, kind leadership. How do we do that? And what I'm missing, not just in this discussion, in most discussion, is, okay, if we are not happy with what we have, then what does it look like when we are happy? So what does this world look like in 10 years? Because you are building new education. That's not for today or tomorrow. That's for 5 years, 10 years, 15 years, 20 years. So how does that world look like? And how do you then discuss the gender imbalance in that and begin to recruit in those ways? So and here, like everywhere else, workforce is very important. What I'm missing a little bit also is that the demand for workforce and demand for health services is not something we can respond to. That needs to be re-articulated. We need to do much more prevention, because we can the people, even if we got as many male nurses as we have female nurses, we couldn't respond to the demand from the society as we are doing health today. So that's also something we need to build in when we work with them, with the gender question in this one. And I would just say, like my good friend in genomics, George Church, said many years ago about privacy in data. How do you make it so it doesn't matter? Thank you.
Thank you, Bogi. Absolutely. We will definitely dive into these questions, bigger questions, why, how, and what can we determine and what the future determines for us. But we are very fortunate to have Marit Kirkevold, Dean at the Faculty of Health Sciences at Oslo Metropolitan University, to share what is already being done and what works, right?
Thank you very much. It's such a great pleasure to be here and listen to this discussion, and it has really been very thought-provoking to listen to the male nursing students and the nurses. In our university, we have been concerned about the fact that we didn't recruit enough male nursing students into the program. We have the largest nursing program in Norway. So we have discussed how to improve the recruitment into our program, and we have launched a project that we call Men in Nursing, that one of our male teachers is sort of heading as a project leader. Marko Stolkovic is his name. We have been working on first recruiting more men or boys into the nursing program. And we have been doing that by actively using our male nursing students in the recruitment process. So we have an open day where we invite the potential students to all of our programs in the university. And we have been conscious about using our male nursing students to be part of that session to show potential students that we have men in our program that is actually studying nursing and that they want to become nurses. And last time we had only male nurses, and it created quite positive attention and energy in this day, because all of a sudden men nurses is sort of fronting the profession. So that was kind of really fun, and I think it really energized and inspired both the students and the participants. And we also do the same thing when we visit our high schools in the area, that we bring male nursing students along to show the boys that this is an exciting career. This is something that if they apply, they will meet other men in the program. And we have seen a rise then in the number of students, male nursing students in our program. So I think this has been helpful. But then, of course, the key is how do we keep them once they enroll? And unfortunately, we have seen, as many other programs have seen, they drop out more than female nursing students. So that this has something to do with how do we actually take care of them once they are in. And we have established an informal network for male nursing students that are really basically social. So the students themselves, they come together, they discuss their experiences, they share challenges, they try to help each other. How can we solve this? And as a consequence, we also see that more male nurses are sort of entering into the student democracy to say, well, we have to do this and we have to do that to actually take care of our students and not only socially, but also in terms of how do we discuss nursing as a profession. And then, of course, one of the things that I think we need to work on, but we have started, is to present male nurses as role models. So they need to see that they are not only sort of colleagues as nursing students, but we have male nurses who are taking different career paths in the future. They are working in a wide variety of nursing roles. They are moving on to take further education. They can become teachers. They can become researchers. And this is something that we see helps, but I think we need to do it much more. And it's thought-provoking, I think, that maybe even we are a bit gender blind when I think about the number of male faculty that we have. So, but I think we are moving forward, and I think it's really excellent to see that we are at least increasing our number of male students, and I really believe that will be important in the future. Thank you.
Thank you, Marit, and thank you also nicely connecting this to the better democratic practices at the university. I see, Alf Johnny, that you have a comment, but let's take it at the question and answer session. Now I would like to invite Christopher Joseph Pearson, an international paramedic student at Lab University of Applied Sciences in Finland, to share your views. And before that, just tell us what brought you to this occupation.
Hi there. Yeah, thank you for the invite for today. So yeah, first just a quick anecdotal story about my background and how I ended up here on a nursing program. So yeah, my background is in scuba diving. Was based in Thailand for 10 years with my wife. And she was also involved in scuba as well. Which led down the pathway to dive medicine. So looking at hyperbarics, prevention of scuba diving diseases such as decompression sickness and what have you, and basically preventative medicine for scuba divers. We were also involved there in military operations, so international search and rescue. And basically that then led us down a pathway to looking at what is the next step to formalize the education and what we were doing there. And then similar to Alf Johnny, when the pandemic hit, we then came back to Finland to sort of rehouse the family back here. So that was why I ended up in the nursing program here in Finland. So the story of my background and then why did I choose nursing? Well, bit different to everybody else. I was looking beyond working in the hospital. So similar to what Bogi was saying, that the future doesn't have to just be in the hospital. The future is beyond what people consider to be the sort of traditional bedside care. I believe there's a true international pathway behind nursing, looking at expedition medicine, event medicine, travel, working in sort of remote locations. All of these events and things need some form of medical oversight, be it a doctor team and a supplementary nursing team. These all need registered nurses. I think from a career pathway, which is something Janette was talking about before, the promotion of allowing young people to know that the pathway is broad. It's not just bedside care. There is, be it working in the OR or using technical skills. It's not just the traditional care routes which people think about that was mentioned before, like Florence Nightingale. There's much wider scope to the broader picture of nursing. And I think that's something that is not being necessarily talked about. You know, people are just considering the traditional bedside care versus looking at the wider scope and the wider picture of what career pathways, both regionally, either nationally or in the EU and then beyond. There is complete global need for nursing. And I think that's something that really needs to be tapped into to try and appeal to both genders, but potentially might appeal to sort of some of the more adventurous type of the male characteristics potentially.
Thanks. Great insights that we should also look at the nursing profession much broadly, and that really nicely coordinates with what Bogi was saying earlier. I think that at this point we are ready to dive into the discussion, right? And to answer the questions from the audience and also to comment, as there were already quite an interest from the speakers before. So Deborah, I will again invite you here to share what you think, how could we start with, as I imagine there are quite many questions, right?
There are a few questions. I will bring up a few of them, and then I will like to also invite the partners which have kind of like to share their perception about it. So the first question that was, or one of them was brought was related to gender quotes and what is our thoughts about it, or what are the recommendation about it. Gender quotes were implemented in different places. The example here is in University of Agder, which was implemented from 2018. I think we also refer to it in the report. Does one of you want to address it?
Yeah, Ole.
Ole, please.
I think the perspective of the need of the patient is the most important question here. So I think it's the most effective tool is gender quotas. And of course, it will only be effective if there are not enough students that are applying for the nursing profession. If men are not applying, it will not be an effective tool. But I think it's a tool that should be used in recruiting the gender that is underrepresented, even if it's engineering or it's women in engineering or in other fields. So that is my basic take on it.
Thanks, Ole. And maybe the panelists want to comment. Bogi or Marit or Chris.
Yeah.
Yeah.
Go ahead.
No, Bogi,
you can.
Okay. So I mean, it's very hard to say if gender quotas generally is the right tool, and it's very dependent on where you are. I mean, some countries are more open to it than others. But I think on a long-term basis, it's very important that there is a representativity in the profession, and also diversity in general. So you get the different understanding of it, like in any other workplace. And I think this is something this is not just in nursing or in health. This is in general that the coming generation are much more demanding on this. So if you don't want to do it today, you would really need to listen and learn how to be more able to listen and adapt to these things.
Thanks. Johnny also had the question.
Wait, Marit.
Okay, yes, Marit, please.
Yeah, I think that it might be a tool to consider. However, I think it's much better if we actually succeed in recruiting males into the profession because they want to work in the profession, and that this is something that they come in also as in competition with female nursing students, because I think this might sort of strengthen some of the attitudes among the female nurses if men are coming in on a quote. So it might be an effective tool, but I'd rather try other effective tools before we go to that tool. Thank you.
Thank you. And Johnny, you had some comment earlier. You wanted to.
Yeah, regarding the same thing. I mean, I think also one of the important things that can be done. I remember, if I recall correctly, that Reform and Roskilde and was it Akureyri did some research on how many of the pictures in the literature, in the nursing literature, was of men. And if I recall correct, Ole may comment on that, but if I recall correct, it was around 11%. So I mean, that will also be that is a bad representation of men in nursing. If you're going to present men in nursing and get more men in nursing, then when you present pictures and videos and whatever, then it needs to be more of men and not only the female nurses.
So before quotas start with more simple measures like actually visual representation. Yeah. Thank you. Do we have some more questions from the audience?
No, I don't think we have more questions at the moment. As far as I see, there's a comment about the social status of the occupation in general, again going to the social status and the low pay, but I don't see more specific questions. Any comments from here? Yes, yeah. Ole?
I just wanted to kind of pick up Bogi's kind of future challenges for the health sector as such, that these also have some possibility to increase the gender balance within male nurses. That there is of course some association that nursing is connected to warm hands, caring, in opposition to technical skills, and also that these challenges will kind of shake up what it means to be a nurse. So and that carries kind of more personal trainer then the connection between the nurse and the patient is closer, and you need kind of a more personal contact. That diversity is even more important than it is in the current situation. So I think it's important to use this kind of foresight in future.
Yes, thanks, Ole, and I would like to invite Edis and Gisli, and also maybe all the other panelists can be.
Yeah, I want to add a little bit, because Boye is pressing a little, with his questions. And I think we all have some kind of a stereotypical view of how nurses work. And I think we are talking about, at least at the University of Iceland and University of Akureyri, that we really need to look into our programs, what we are teaching. And it's not the just technical or caring hands. What we need now in our society is upstream healthcare. What does that mean? It means prevention and promotion for our young people and for the families. And nursing needs to go into that with a very strong point. So nursing is so wide, and we sort of put it sometimes we put the profession in a simple way, because it's more complex. Our work is more complex, and it's going to attract different people in all kinds of nursing work.
So it's also part of promotion or how we address this. Yeah. Marit, do you want to answer also, to add something?
Yeah, I think it's very important to acknowledge that nursing as a profession today is very complex. And although I agree very much with Bogi that we need to think about what is the nursing role in the future, I think it's the wrong way to go to sort of suggest that in order to get more male nurses into the profession, we need to move away from sort of the caring thing to something else. And I also think that our male nursing students and the male nurses I know, they are equally interested in the caring, long-term care aspects as in the more acute things, and also in the prevention. So I think that nursing is a very complex profession with many skills, and we need all the nurses, both the female and the male, to look at the whole broad picture of the profession and then choose from that. Thank you.
Bogi, can you address this?
Yeah. So maybe I just to be very precise. So what I look first and foremost is what are the challenges and what are the opportunities in a society. The bigger picture of health is to move it from being a burden, so something you need to do when things go wrong, to being an asset where you build resilience in society with improving health. So the reality today is, and this is not the fault of the health system, the reality today is that 30% of the disease burden on chronic disease that we deal with in our health system is avoidable if we did it with the knowledge and technology that we already have. It requires new ways of paying. It requires new way of structuring. So when we have a huge discussion on that we need more staff, in principle, in general, not talking about gender, that will not solve the issue that we have, because we are not intervening when it's best for the population. So this comes back to my core question: are we doing this for the health system, or are we doing this for the population? And that question to me is the recruiting question. That's where you get the right people in. That's where you build on. And I'm fully in on that. Nursing is very complex, much more complex than I understand. But what was said also before on going more into the society and taking roles that you actually had before. It's not roles that didn't exist before but have been diminished because everything is being pushed into the hospital. So the hospital needs to become a backbone. And I think the reason why it's so hard to imagine now is that digitalization has become a burden rather than a help, because it's so much putting data in without getting value out. That will change. So we will not think about data. It will be there. It will be automated. It will automatically register, not all, but some of it. So now I'm saying 5 to 10 years from now. So it's also an enhanced warm hand, but you would need to understand technology just as you understand science today in that part.
Thank you. Do you want Christopher, do you want to comment still?
Kind of, yeah. It was the point was somewhere in between what Børge and Marit were mentioning to do with in terms of raising awareness for future students of the full range of what is available to healthcare or potential future nurses, that it can be something not necessarily paramedic based, but pre-hospital AI, computer technology integration, or it can be bedside care. It's about educating the future students that nursing is not just about bedside care. Yes, that is a fundamental part of it, and nursing extends to caring for just a patient. We're then looking at the whole family as a kind of care package, if you will. But I think in order to attract future, not just male, but future nurses in general, people need to know about what career pathways as a total can be available to them. So tapping into somebody who might look at, oh, I could go and do some technical aspects in the operating theatre as a scrub nurse, or I can go and do some preventative medicine, or I can go and work in the laboratory and do screening. There's a whole plethora of different options available to nursing or to the registered nurses, and it's about letting people know the sheer variety that's available to these people once they've graduated.
Thank you.
Yes,
And if people don't know about it, then we're not going to attract more future nurses.
Yeah, and I think that's true. It's a very good point, Chris. It's true, I think, for all genders that the diversity of what nursing is important to introduce to everybody. I think, why are we doing this? And, we're trying to do this for the service users, so we have enough nurses to go around with that meet their needs, and when it comes to diversity and knowledge, of course. But I think for me, listening to you, it's been very, very cool for me, at least. One of the things that I've been thinking about, and I've learned, I've been doing this. My first project for males and nurses started in 2001, so it's been 23 years. I don't know how old that makes me, but it's kind of scary to think about. But anyway, what we've learned is that it's very difficult to navigate the narrative here, because we don't want to use essentialism to, and some of you have mentioned that, essentialism to sell nursing, really. We want to emphasize how diverse it is and how different skills are needed for nursing, regardless of gender. But we need to, though, I think, be very careful of using essentialism. In Iceland, this is called pissing in your own shoe. So it's very warm and nice to begin with, but then you run into trouble when it starts to get cold. So, yeah, sorry for the Icelandic analogy here, but I think it fits the bill. Thank you.
Thank you so much, Gisli. At this point, we have to finalize as time is over, and I would really like to thank all our speakers at the webinar, all the panelists, and also you, those who participated. There is a very quick, very fast feedback survey that we kindly ask you to fill, that you see right now in your screens. But before that, also, I would like to thank other contributors to this webinar, Marija Zelenkauske and Anna Regina Tvite, for helping us to set it all up. And let's keep these conversations going. It's clear that we could stay for 1.5 hours or even more to discuss those philosophical questions related to the future of health and our role in it. And I think it was really interesting to hear also the practitioner's point of view, and definitely check the reports, ask the authors, write the questions to them directly. We all will be responsive to that. So with this, have a good day, and thank you for participating.